This is a common stool sample test that we do at Colorado Center for Functional Medicine. When you receive this box, you'll have your requisition right here at the first slide out. And with your requisition, you'll want to make sure, of course, it's signed by us and the provider is checkmarked. The billing on here, how much you'll be owing for it or how insurance will pay for it. The insurance ICD-10 coding may or may not be necessary, but we'll have all of that filled out for you. And then, of course, the test will be filled out. What's most important for you, though, is that you fill out this information up here to the best of your ability. And then you also fill out the payment section, and then your insurance card will go with this if we're using your insurance. So once you have that completed, that's of course vital. Then when you do the stool sample, you'll have all of the instructions in here. So this is the GI Effects 1 day instruction. Sometimes we'll do a 3-day, but this is the 1 day. And if you'll want to follow all of the instructions that are in here. A couple of important notes on here. And it says, of course, talk with us about any medications or supplements that you're doing. This will say discontinue antibiotics or antiparasitics and antifungals, anything like that. This is all 2 to 4 weeks before the test. Discontinue proton pump inhibitors. This is what it will say to do, but generally we want you to continue doing these, because if you just stop these right away, generally you'll have a rebound and you'll get much worse if you're experiencing any type of reflux or heartburn. So talk with us before discontinuing any of these types of medications, but we will let you know as well. Discontinue aspirin and other NSAIDs if those are not 2 days before the test. Digestive enzymes, betaine HCl, additional laxatives. You'll see here what to discontinue, and that's perfectly fine to do so. So stool collection, of course, you'll put on the gloves, you'll collect your stool right inside this nice little French fry basket that's here. And then you take your stool from this French fry basket and you make sure you put it in these vials. So one, you want to take various different parts from your stool to make sure that we can get a good random sample throughout it, and that way we're not just getting everything in the beginning and missing out on what's at the end. And then you'll fill this up and make sure you fill it to this line. And what you'll want to do when you do fill it to that line is tap it onto a table or anything like that so we can get it right at the line, because we want it to be very appropriate weight. We don't want it to be too full or too little, or else the sample will be denied, and that of course makes you'll have to redo the test. So same thing there, you'll fill that up. You'll fill it up to this line on this one as well. Make sure you push it down. And then same thing with this one. This one's going to go to the appropriate level on here too. I believe it will say 40 milliliters. To the 40 milliliter fill line, do not overfill. Okay? And you also do not freeze. So just make sure you're reading all of these steps step by step. And then when you're done with that, you'll put it in and you'll mail it off within this FedEx label that's in here. And that's how you'll complete the GI Effects.